Depression is the most common mental health problem in the world today. Around 17% of adults in the UK experienced some form of depression in the summer of 2021, compared to just 10% before the pandemic. But because it's a common mental health problem, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and or feeling depressed. Almost everyone feels down from time to time. Getting a bad exam result, losing your job, having a relationship end, even a rainy day can bring on feelings of sadness. Sometimes there is no trigger at all and it just comes out of the blue, then circumstances change and those feelings disappear. Clinical depression is very different. As it's a mental health condition, it won't go away just because you want it to. It lasts for at least 2 weeks and interferes with your ability to work, to have fun, and enjoy just about anything. I'm Andrew Flynn, your host, and I'm a qualified counsellor here in the UK. Please leave a comment if you're struggling with depression. As a community, we can support, so let's start a conversation. Depression can have lots of different symptoms, from a low mood, loss of interest in the things you'd normally enjoy doing, changes to your appetite, feeling bad about yourself or excessively guilty, sleeping too much or too little, restlessness or slowness, loss of energy, or recurring thoughts of suicide or suicidal ideation. If you have at least 5 of those symptoms, according to the mental health guidelines, you may qualify for a diagnosis of clinical depression. And it's not just behavioural symptoms either. Depression has physical manifestations inside the brain. First of all, there are changes that can be seen with the naked eye using an X-ray machine. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin and dopamine, essentially our happy chemicals. Also, blunted circadian rhythms or specific changes to the REM or slow wave parts of your sleep cycle, affecting how we sleep, as well as hormone abnormalities such as high cholesterol and the deregulation of thyroid hormones. However, neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and the environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. As depression symptoms are intangible, it's hard to know who might seem okay but is struggling. According to the National Institute of Mental Health, it takes the average person suffering with depression 10 years to ask for help. But there are very, very effective treatments. I know and have seen the positive results using medication and counselling to complement each other to boost brain chemicals. If you know someone struggling with depression, encourage them to seek out some support. If you are struggling with depression, these first steps can seem hard. If you feel guilty or ashamed, I want to point out that depression is a medical condition. Just like asthma or diabetes, it's not a weakness or a personality trait. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts reduces their suicidal risk. Open conversations about mental health help erode stigma and make it easier for people to ask for help. Thanks for listening, and do reach out for support if necessary. Again, my name's Andrew Flynn. If you enjoyed this content, please subscribe to the channel and hit the like button. And I'll see you all again really soon.